When placing an IV in a patient, there are many steps to take and things to consider. For instance, what gauge catheter should be used? There are a number of factors that will influence this decision, and this video will help give some direction and understanding to this pivotal part of IV placement. 22 gauge, 20 gauge, and 18 gauge catheters are commonly stocked in the unit pod rooms. 22 gauge is the smallest and 18 gauge is the largest. There are a few factors that come into play. The larger the catheter diameter, the faster fluids or medication can be delivered into the vein. Smaller diameter catheters will restrict the speed of delivery. Also take into account the size of the vessel in which you will be placing the catheter. In general, the further down the arm, the smaller the vessel. Smaller vessels mean less blood flows through the vein every minute, and flowing blood is what carries the fluids or medication back to the heart to be dispersed through the body. When you insert a catheter into a vessel, it will occlude part of that vessel, but you still need blood to be able to flow through the vein to carry that treatment to the heart. There is a common misconception that bigger catheters are always better, but bigger catheters will occlude more of the vessel, and if the vessel can't handle that size, blood flow could be severely impacted, along with medication delivery. For most general treatments for adults, 22 gauge or 20 gauge catheters will be appropriate and result in less vessel occlusion. 18 gauge is only really necessary with large volumes of fluid or medication that must be infused at rapid rates. Also, the larger the catheter, the more damage will be done to the vessel, and the less likely your IV is going to last. So to give your IV the best shot at lasting a long time, a good principle to follow is to insert the smallest gauge necessary for treatment into the largest vein available.